Hi, my name is Heather, and today I'll be your student nurse. Can I have your name and date of birth?
Janet Tobin, 7/27/77.
Okay, I would go ahead and I would verify her bracelet. I would make sure that I perform hand hygiene by washing my hands or using hand sanitizer as well. I would make sure that I close my curtains or close the door as well. Today I'll be performing a head-to-toe assessment on you. I will be asking you a variety of questions and asking you to perform a couple activities throughout. If you have any questions for me during the assessment, you can feel free to stop me. Before we begin, are there any cultural considerations that you'd like to be made aware of at this time?
No.
And do you have any questions for me today?
No.
Do you have any allergies?
No.
Do you take any prescription or over-the-counter medications?
Nope.
Any herbal supplements or recreational drug use?
No.
Okay, I'm going to go ahead. I'm going to start by moving into the neurological part of the assessment. Have you had any past trauma, surgery to the head and neck?
No.
Do you have any family history of Parkinson's, epilepsy, brain cancer, or Huntington's disease?
No.
Have you experienced any headaches, dizziness, numbness, tingling, tremors, weakness?
No.
Do you have any personal history of depression, mood, or behavioral disturbances?
No.
Okay, I'm going to go ahead and I'm going to be checking your pupils at this time. I'm going to have you look straight ahead at me, and I'm just going to be looking at reactivity of the pupils. Good. I'm going to have you go ahead and look straight at this pen. The entire time looking straight at it. Good. So both pupils are equally reactive and they're accommodating to the pen as well. Do you wear glasses at all?
Yes.
And are you up to date on your visual exams?
Yes.
I'm going to go ahead and check your level of consciousness. I know you've already given me your name and your date of birth. Where are we today?
At the hospital.
And what month are we in?
November.
I'm going to go ahead and assess your speech. Can you read that to me?
The early bird gets the worm.
And can you tell me what that means?
The earlier you are, the better the good.
Good. I'm going to go ahead and I'm going to assess your cranial nerves. I'm going to assess cranial nerve number 1, which is your olfactory, which is your sense of smell. I'm going to have you close your eyes. Can you tell me if you smell anything?
Yep.
And what do you smell?
Garlic.
You can go ahead and open your eyes. Cranial nerve number 2 is your optic nerve, and at this time we would be checking using a Snellen chart or a Jaeger chart. We're going to move into cranial nerve number 3, which is the oculomotor, which is, we already did that, which is the pen light and the accommodation. Cranial nerve number 4 and cranial nerve number 6 is the trochlear and the abducens. I'm going to have you go ahead and follow my finger. Good, and this just checks your 6 cardinal fields of gaze and also just checks your eye movement. I'm going to go ahead now and I'm going to check your cranial nerve number 5, which is your trigeminal nerve. Can you clench your teeth for me? Any pain? I'm going to check your masseter muscle. Any pain when I palpate? And I'm going to have you go ahead and close your eyes. Can you tell me if you feel anything and where you feel it?
Yes, on the left.
And how about now?
On the right cheek.
Okay, good. I'm going to also now test your cranial nerve number 7, which is your facial nerve. Can you go ahead and smile for me? Can you raise your eyebrows up? Can you frown? Can you puff out your cheeks? And now I'm going to go ahead and check your cranial nerve number 9, 10, and 12. Can you go ahead and, in a normal situation, I would ask you to remove your mask, but if you can just pretend at this time. Can you go ahead and open your mouth for me? And can you go ahead and swallow? And I would use my pen light, and I would also use a tongue depressor to move the tongue side to side and look at the uvula rise and fall. Can you go ahead and say ah? Good. And then I'm going to go ahead and have you bring your head to the right. Push against my hand and push against my hand. Good. Push against my shoulders. Good. And that checks your spinal accessory nerve. I'm going ahead and I'm going to check your your vestibulocochlear nerve, which is your hearing. I'm going to do a whisper test. If you can tell me what you hear.
Dog.
Good. So all of your cranial nerves appear to be fine at this time. I'm going to go ahead and have you grip my hands for me. I want you to squeeze nice and tight. Good. I want you to push up and I want you to push down with your toes. Good. Bring your hands up and then bring them down, and bring your legs up one at a time and then bring them down. Good. I'm now going to go ahead and I'm going to move on to your cardiovascular. Have you had any history of trauma or surgeries to your cardio system?
No.
Any family history of heart disease, congestive heart failure, or hypertension?
No.
Do you smoke, have high blood pressure, or eat a high-fat diet?
No.
Do you ever have any chest pain or leg pain or shortness of breath?
No.
Okay. And I'm going to go ahead and I'm going to check your vitals at this time, okay? Normally I would be checking your temperature orally or temporally, but we're going to skip that for today's session. So I'm going to go ahead and just check your skin temp, the back of my hand, and it appears to be normal. And I'm going to go ahead and now I'm going to check your blood pressure. Any arm that you prefer?
Doesn't matter.
So I'm going to just check it by palpation first. And I stopped feeling it at 120. I'm going to give it a second. And I'm going to check it manually. Good. Your blood pressure is 124/82. I'm going to go ahead and write that down. I'm going to go ahead now, I'm going to listen to your heart. I'm going to have you just go ahead and lift up your breast if you don't mind. Good. And your apical pulse is 72. All right, I'm going to go ahead. I'm just going to look at your skin. I'm going to just check your capillary refill. I'm just gonna look at your legs. Any history of swelling? And you said no leg pain at all?
No.
Any issues with cuts or wounds that don't heal? Okay, I'm gonna now move on to your actually let me just check your peripheral pulses here. I'm gonna get your radial pulse. $74. I'm just going to check them both and compare them. Good, nice and strong. I'm just going to check your carotid. Nice and strong. Good. Your radial pulse is 74. I'm now going to move on to your respiratory check. Do you have any history of trauma or surgery on your respiratory system?
No.
Any family history of asthma, COPD, lung cancer, or emphysema?
No.
Do you smoke? Do you vape or use tobacco products?
No.
Are you exposed to any secondhand smoke, mold, asbestos, or any type of environmental pollutants? Do you experience any coughing, shortness of breath, wheezing?
No.
Any discomfort during breathing?
No.
Any difficulty performing your activities of daily living, like getting dressed or showering or taking care of yourself?
No.
All right, I'm going to go ahead now and I'm going to listen to your lung sounds. I'm going to listen to them from the front and then I'm going to listen to them from the back, okay? Take some nice deep breaths for me. And have you lift your breast for me? Good. And your respiration rate was 18. We're about midway through the assessment. Do you have any questions for me at all? Okay. I'm gonna go ahead and check your abdominal system now, your gastrointestinal system. So I have a few questions as far as that. Have you had any trauma or surgeries at all to your GI system?
No.
Any recent changes in appetite or weight changes at all? Weight gain, weight loss?
No.
Any food intolerances?
No.
And have you had any history of nausea, heartburn, constipation, or diarrhea?
No.
And how are your bowel habits?
Good.
Okay. I'm going to go ahead and ask you to lay down for me.
Okay.
Either way, whichever one you're comfortable. I'm going to get you a pillow for your head.
Okay.
So I'm going to be inspecting your stomach. I'm going to be inspecting for any skin abnormalities. I'm going to be checking for any scars, any masses that I might see. Normally at this time, we would be doing this without clothing on as well. Have you had any pain at all in your stomach?
No.
Okay. And now I'm going to go ahead and I'm going to listen to your bowel sounds. I'm going to be checking with your right lower quadrant. Good. And I'm able to hear bowel sounds, which is a good sign. I'm going to go ahead now. I'm going to be palpating your stomach. So I'm just going to be feeling for any tenderness or any abnormalities. If you have any discomfort, just let me know, okay? Any discomfort or tenderness? Okay. I'm going to have you go ahead and sit back up at the edge of the chair here. All right, I'm going to go ahead now and I'm going to be checking your musculoskeletal system. Have you had any surgeries or trauma at all to any of the bones or joints in your body?
No.
Okay, are you able to feed yourself, dress yourself, walk around? No problems with that?
No.
Do you use a device at all, such as a cane or a walker?
No.
Okay. Do you have any stiffness in your joints or difficulty moving?
No.
Any swelling or pain?
No.
And any deformities in your bones or any joints?
No.
Okay. Have you ever had any diagnoses of musculoskeletal disorders?
No.
Okay. I'm going to go ahead and inspect your joints and your bones as well again. And I'm just going to check your spine. Any tenderness?
Nope.
Sorry. Can you go ahead and push up with your toes? And then push up with your other toe. Push down and push down. With this leg, can you go ahead and push up? And push up? And push out against me? And push out. Good. Can you bring your arm out straight? Can you push up to the sky? And push down. Same thing with this one. Push up and push down. Good. Can you go ahead and bend your elbows? Don't let me pull them. Don't let me push them. Same thing. Don't let me pull and don't let me push. Good. Can you bring your head to the side and to the side and then forward and then back? Good. I'm going to have you go ahead and step down for me. Can you bend over and touch your toes? Any pain at all with doing that? Okay, go ahead and stand back up. Good. I'm going to have you walk for me. Just walk to the doorway and then back again. And then walk normal. Good. I'll have you turn and walk one more time. I want you to walk in a heel to toe fashion like you were walking on a tightrope. Good. I'm going to go ahead and I'm going to check your balance. I'm going to do what's called a Romberg test. I'm going to have you stand with your backside against the table. I'm going to have you stand with your arms down by your side. And I'm going to have you close your eyes for approximately 20 seconds, okay? When you're ready, you go ahead and you let me know. All right, I'm going to start timing. If you feel dizzy at any time, go ahead and open your eyes. Good, go ahead and open your eyes. No dizziness at all? Good, all right, and I noticed you didn't lose your balance at all. You can go ahead and have a seat if you'd like. We're just gonna finish up. I have a few more questions about the urinary system. Have you had any trauma or surgery at all to your urinary system?
No.
Any recent changes with urinary habits at all? Any incontinence? Any history of UTIs?
No.
Any burning with urination?
No.
Increased frequency?
No.
Any abnormal colors or odors?
No.
Okay. So today's assessment seems to be completely normal. I'm going to go ahead and notify the doctor that there haven't been any changes since the last time you were here and that everything appeared normal. I've also documented all of the assessment findings today. Do you have any questions for me?
No.
Okay. So I would, at this point, go ahead and I would take off all my PPE, wash my hands, and I would document my findings and let my patient know that if there's any changes in medical history, feel free, and any medical changes to come back in and to be monitored. Otherwise, we'll see you in 6 months to a year. Okay?
Good.
Thank you.